So, one of the big overlooks that therapists and medication providers make when they are working with a client who has been diagnosed with ADHD is that we overlook the fact that 96% of people with ADHD also experience anxiety and also dysthymia. And if you don't know what dysthymia is a fancy word for depression. It's not like the major depression that keeps you in your bed all day and has you like crippled and crying. It's more like the constant persevering daily depression that makes it kind of difficult to do things, which can also be kind of like hidden by executive dysfunction. So that's why it's important to ask the right questions. Like, okay, are you having trouble doing this because you're having trouble organizing your thoughts, or having trouble doing this because you're having trouble with motivation? And if you're having trouble with motivation, is it because your ADHD has you in a paralysis, or because you're actually dealing with depression and the energy and motivation is not there because of the depression? It's all very complicated. It is. It's very complicated. But if you actually ask the right questions and if you know what you're doing, you can figure things out with your client. And the great Russell Barkley, my personal saint of ADHD, says that about 96 to 97% of people with ADHD also experience anxiety and dysthymia. So when we are treating ADHD, we have to also be treating the anxiety and depression. We have to be able to assess for those things. We have to be able to include those things in our diagnostic plan, because depression and anxiety contribute to the negative functions of ADHD, such as executive dysfunction and emotional dysregulation. And if we're not treating all three things as a unit, we're doing a huge disservice to our clients and to the community as well, because people are going to go and they're going to go, man, therapy didn't work for me because I'm still kind of a hot mess express, because we're not treating the system as a whole. I guess what I'm trying to say is you're more than just a pretty brain. You're a whole system.